The Advanced Critical Care Practitioner role is based on experienced critical care nurses and physiotherapists who've done additional knowledge, skills and competency training to be part of the workforce solution for critical care. Day-to-day, ACCPs manage patient episodes, and that would include comprehensive assessment, history taking, prescribing necessary medications, ordering and interpreting investigations, all contributing to the management plan. In the same way as junior medical staff would in the intensive care unit, we interact with a multidisciplinary team in the interests of the patients and support patients and their relatives through their intensive care journey. Predominantly we're based in the intensive care unit, however we do get involved with management and caring for patients wherever they may be. If they're critically unwell, that might be the emergency department or the wards.
Well, the ACCP role solves a huge problem for us, which is the resilience of our workforce at both a junior doctor and middle grade level. We're always short of those staff, and clearly they provide not only a high level of quality and expertise and safety, but they're here for a long time, so they meet a massive need for our service.
I think when the ACCP role started here, it was a great opportunity for us to really value the nursing skills at an advanced practice level. It gave a great opportunity for careers to develop, and it's importantly kept nurses by the bedside. And in terms of being part of that team, this is how we best utilise those unique skills of the whole team.
The ACCP team is crucial for our critical care unit within our trust. The ACCP team are part of our sustainable workforce plan. For us to achieve that workforce, we need to help them with the regulations to look at introducing different professionals such as ODPs and paramedics to join the team.
From my perspective as a consultant surgeon, the ACCP role is increasing that support that we need between areas of the hospital, ever increasingly complex care that's delivered, and bringing maturity and experience across departments and supporting patients through. To me, they've become a real value from the intensive care unit and the transfer to the ward and vice versa.
Prior to being an ACCP, I was the clinical lead physiotherapist on intensive care for 15 years. What that's enabled us to do is maintain that experience, knowledge and skills at the patient's bedside. It also allows us to maintain quality standards for the patient. We're able to support the trainees coming through, rotational staff that don't know the unit, don't know the systems. We can maintain a decent quality of standard of care for patients, and also vast experience in audit, making sure that we're being evidence-based in the work we do.
It came quite clear early on into the ACCP training that it was a very structured curriculum leading to FICM association at the end. As well, it's nice that it gives structured career pathway that can lead you up to becoming consultant ACCP.
Well, I've had the benefit of working with several of the ACCPs, both trainees and qualified staff, and I found them really helpful both as a trainee doctor and just personally really in terms of supporting relatives as well as other staff on the unit. It's a very mutually beneficial relationship, and they also allow us to have a bit more time for the other doctor related training by taking some of the pressure off the trainees for some of the other tasks around the critical care area.
Our ACCPs are locally trained and are permanent staff and represent a constancy and highly consistent, high quality level of care in the face of a rapidly changing medical workforce. They are well versed with local procedures both within the hospital and on the intensive care, and provide a very important bridge between the medical and the multidisciplinary team.
For us, the ACCP role provides a vital interface in terms of communication between the nursing and the medical staff. They also deliver very individualised patient care and are a very valuable resource to us in terms of teaching and education.
Our ACCPs are a fantastic group of permanent staff here who are able to support junior trainees at night in both their clinical duties, and it enhances their learning opportunities too. Our FICM associated ACCPs are also able to sign off anaesthetic and intensive care competencies for our trainees, which is both useful for the trainees and relieves some of the pressure for the consultant staff.
The ACCP role is very important for the emergency department. One of the great advantages is that we're very familiar with the individuals who've often been here for a long time, so they understand the processes within the hospital. And importantly, from our perspective as emergency physicians, we know exactly what their ceiling of capabilities are, exactly what their skill set is, and that's very important when you're dealing with the critically ill.
The ACCP role is a new way of working. I've previously been involved in management and education. This offers a clinical opportunity to stay at the bedside, and for me, in terms of job satisfaction, it doesn't come much better than that. What we're looking for now is we have the recognition of the Faculty of Intensive Care Medicine. We're looking for the wider NHS to consider the role in terms of funding and regulation.
With the ACCP, people like Carol Belanga, Dr Black, Dr Day, I wouldn't be here. It's as straightforward as that. I had bee flu, pneumonia, multi-organ failure and severe sepsis. Friends of mine have said, it's a miracle that I'm alive. It's not a miracle, it's down to the ACCP that had the passion to go beyond what I would class as normal. It is unbelievable what they did for me, and I will never ever forget them.